Welcome to the Glasgow Clinical Research Facility. My name is Dr. Alan Gaw and I'm the Director of Operations here in the CRF. Glasgow has had a long and distinguished record of medical research, extending back more than 2 centuries. Over this time, we have been at the leading edge in the discovery of new treatments for many illnesses. For example, in this city, Lister developed antiseptic surgery and Donald developed ultrasound. The first X-ray department and the first clinical biochemistry laboratory in the world were established in Glasgow hospitals. But we can't rest on our laurels. We all want Scotland to continue being at the forefront of what's new in medicine, and it's important that we go on contributing to improvements in healthcare, not just for the people of Glasgow or even Scotland, but for those around the world. So today, modern researchers are working hard on hundreds of projects in the city, some of which will change the way medicine is practiced around the world in the years ahead. However, in recent years, there have been major changes in the regulations and laws relating to medical research, which have made it more difficult to conduct clinical trials. One way to ensure that researchers can still carry out their work with as much support as possible is to create research facilities like the CRF where you are now. So what exactly is the Clinical Research Facility? We are part of the NHS and we are funded by the Scottish Government so that we can support healthcare professionals to do their research. We have an excellent team of support staff who can work on all aspects of medical research. Of course, we don't do it all ourselves. We work closely with partners in the universities in Glasgow, as well as other clinical research facilities around the country, especially those in Edinburgh, Dundee and Aberdeen. As you look around the CRF today, you will see that in some ways it looks just like a normal hospital outpatient clinic, or perhaps a small hospital ward. The difference is that these areas are only used for medical research. All the equipment you see is only used in the various clinical trials that we are involved in. All our staff, our nurses, doctors and administrators work only in the CRF and are able to devote all of their time to medical research. But if it wasn't for the support of our research volunteers, all these resources would be useless. We simply can't do medical research without the help of people like you. Some patients or healthy volunteers may visit us only once. Others will become regular attenders, sometimes over the months or years of a study. Others will spend some time overnight with us as inpatients. It all depends on the kind of study we're doing and what we hope to learn. We started all this back in 2006 and built the CRF over the following 18 months. And we have been getting steadily busier as time goes on. Last year, in 2008, we saw over 3,500 patients. And with your help, we expect these numbers to keep rising. At the CRF, we are also involved in training and education, and we spend a lot of time teaching people from Glasgow and indeed throughout Scotland about the conduct of clinical trials. To date, over 1,000 doctors and nurses and other healthcare professionals have attended our courses. The CRF then is an exciting place to work and an important development for Glasgow, but it's important to remember why we're here. On that note, let me end with some words of wisdom from someone who is more famous for looking after patients than for their research, but who in fact was very eminent in medical research. I'm speaking of Florence Nightingale. She said, "It must never be lost sight of what observation is for. It is not for the sake of piling up miscellaneous information or curious facts, but for the sake of saving life and increasing health and comfort." We do research to make medicine better for ourselves and our children. The best medical care must be based on the best evidence, and the best evidence comes from the best clinical trials. That's what the Glasgow Clinical Research Facility is all about. Thank you for coming to see us today. I hope you find your visit both interesting and enjoyable.